Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Welcome back to another episode of the Dental School Guide podcast. And here today we have the dental admissions team for High Point University, Dr. Shazib and Dr. Jasmine Cromartie-Hicks. So we are super excited to have both of you on with us today. Welcome to the show.
Thank you so much for having us.
Thanks so much for having us here.
All right. Well, first and foremost, High Point is a brand new school. We really want to get to know High Point and how you guys are kind of changing the dental education space. But first, I'd love to have you guys introduce yourself. That way, students all around the country know who you are and who they're going to be interacting with as they come to school there potentially. So, Jasmine, would you like to go first and tell us a little bit about yourself and where you're from?
Sure, absolutely. So, hi, everyone. I'm Dr. Jasmine Cromartie-Hicks. I'm originally from Winston-Salem, which is literally around the corner from High Point University. I went to High Point University for undergrad, so this has been a full circle moment for me to join its faculty and one of the biggest blessings of my life. I played basketball here at High Point and then went on to East Carolina University, where I received my Doctor of Dental Medicine and completed an AGD with ECU as well. Went into private practice and then decided that I couldn't sleep without being in academia. So here we are. Now I serve as Director of Student Admissions and Engagement here at the Workman School of Dental Medicine. I'm also a clinical assistant professor, so you can find me in the classroom. You can find me in the simulation lab with the students after hours. You can also find me recruiting students to what I think is the best profession in the world. So thank you for having me.
All right. Thank you so much. That's a great intro. Dr. Shazib.
The best part of my job is I get to work with amazing people like Dr. Cromartie, and it's such a pleasure being here. So my name is Ali Shazib. I serve as the Dean for High Point University Workman School of Dental Medicine. Prior to that, I was Chief Dental Officer here at High Point University Workman School of Dental Medicine. So my role and my capacity was to build the clinical network and the clinical infrastructure and to pass us through a lot of the pivotal milestones, such as accreditation and the type of clinical experiences that our learners and our patients will receive throughout the program. My own background, my family background is from Pakistan, and I also have step-parents from France and Singapore. So I have been in many different countries and have experienced dental school, having gone through dental school in Pakistan for my first school experience. Then went to dental school here in Boston University, where I did my advanced standing DMD program. After that, I had worked in a DSO up in northern Maine, where I had the opportunity to grow and expand the territory there. And I ventured into private practice, owned my own private practice up in Maine. And then I really got interested in the oral systemic health link and pursued a residency training in Harvard, where I did oral medicine, which is a specialty focused on managing patients with complex needs and oncology. And that brought me to North Carolina at UNC, where I was formerly faculty at the Adams School of Dentistry at UNC Chapel Hill, where I was the medical director there to bridge the gaps between the medical and dental school and all the patients that have medical needs that go between the cracks between medicine and dentistry, and to address those. And then here I am at High Point University. So it's been a real circle that I've taken here as well, and all the different environments that I've been in the capacity as a dentist. And the field is really at an exciting turning point.
Well, I love it.
Right
I love how both of you have experience both with DSOs, private practice, academia, and you guys have kind of both all come full circle, which is really cool. That shows your breadth of knowledge of the dental industry, which is great. So I love it. Well, let's talk first and foremost about High Point. It's a newer school. Tell us first, let's kind of do a broad overview. what's the history of High Point, and what are some of the goals that High Point has as a new school? You guys are kind of shaking up the industry, which is, I think, is a very cool thing.
Dr. Shazib, do you want to take this one?
Happy to do so. High Point turns 100. We're in our centennial year, so it's a really exciting time for us at High Point University at the greater scale. And the last 15 to 17 years, under the leadership of President Nito Cobain, High Point has witnessed very, very exponential growth. And the exponential growth is intentful and sustainable. We have developed programs in health sciences that include physician assistant, physical therapy, nursing, optometry as we speak, and now the launch of a law school that was in tandem with ours. So at High Point University, growth is sort of in our DNA. It's really what's next. What are we going to do next to impact the needs of our community and industry? And segueing from there, the High Point University Workman School of Dental Medicine is really a formula of that growth. And the way we have designed our program is to look around, what are the assumptions, what are the needs, what is going on in education, what is going on in healthcare, what's going on in industry, what's going on in the population that we will be serving, and how do we create a model that will continuously address those needs. So from the way we design our personalized curriculum, which is known as the Clinician Advocate Research Entrepreneur Curriculum, to the way we have electronic health records such as Epic, which is integrating us with the entire health system so our patients can communicate with us just like they would communicate with a medical doctor, and then bringing in technology at the forefront, such as artificial intelligence, digital dentistry from scanning, designing, printing. All of those are sort of the little bit of elements that we've trickled in throughout our program, with the most important thing of High Point University, which is life skills. Life skills means, am I emotionally intelligent, agile, communicative, and do I understand what it takes to be successful when I'm looking out for something that I want to do in my life when I graduate. So we want our students to go through an experience when they graduate. They can be thought leaders in whatever environment they want to go into. It could be a DSO, it could be a material science lab, or whatever it is. And that is really the High Point way, is to make sure that the life skills are always inculcated throughout
That's
the program.
wonderful. Dr. Cromartie, anything to add there?
Oh my goodness, that's a tough act to follow. I think you did an awesome job, Dr. Shazib, of really just summarizing all of what High Point is about and what we represent. There's not much really to add to that, other than we are shaking up the industry as we speak, and we are changing academia as we know it when it comes to dental school. And we are up for the challenge. There are new things that we are incorporating every day. We're not afraid to change it up if we feel like something's not working. And we're actively asking our inaugural cohort that's here now, what's working and what's not. Active feedback, I think, is one of the things that is missing in a lot of dental education. And we take a lot of that feedback and we put it to gear when we need to change things up. And so I think that's what's really different about our program. And another awesome thing is the wonderful faculty that we are, that are joining our program constantly. I mean, the things that we're looking for in our learners is exactly what we're looking for in our faculty, and it shows. We wanted to create a culture in an environment that was welcoming, with an open door policy where our learners feel like they can come to us for anything, because we are all learners, essentially. We're all learning. Even after you get your degree, you're still an active learner. You're still a lifelong learner. And so we're just really excited about the opportunity to be here, to be on the forefront and really be the first with this type of academic model. And so I'm sure we'll talk a little bit about that.
Yeah, I'm excited to jump into that. So one of the things that we try to do at Dental School Guide is to try to debunk the myths that there's a lot of misconception about the admissions process, different dental schools, and especially when a new school comes into the market, there's a lot of like unknowns. And then like Student Doctor Network and Reddit just start going crazy with like these weird random assumptions. And so we want to make sure we're getting the correct information. So one of those things, we're going to go through some of those questions really quick to kind of debunk some of those myths and get the true answer. So one of the things that we commonly see on Student Doctor Network and Reddit is, hey, I heard High Point is a Heartland Dental School. So Dr. Shazib, do you want to explain what that relationship truly is like and how it actually is a good thing for High Point University and for students long term?
Thank you. And this is such an important point you bring, and I appreciate you bringing this up front. we believe that the most important aspect of our educational model is that our students know all the dimensions that are involved in our healthcare sector. And when we look at access to care, dental support organizations are a huge part of that. And almost 35% or more of graduates choose dental support organizations such as Aspen, Heartland, Pacific, and many others as a very fulfilling part of their employment journey. Our school, the Workman School of Dental Medicine, was named, the school building was named after the founder of Dr. Rick Workman, who is the founder and owner of Heartland Dental. Apart from that, which is the support for the philanthropic support for the dental school being named after the Workman School of Dental Medicine, the operations of the school, the accreditation status, it requires us to utilize and perform our operations as a non-for-profit academic system, which has its own governance, its own policies, and its own protocols and measures for success. So that is our relationship with, which is the Rick and Angie Workman Foundation that had generously donated to the HPU, to High Point University for naming the school. Like other schools, like the Adams School of Dentistry at UNC is another example where a very prominent family named the school. And if you look across academia, many structures of excellence or institutions of higher excellence have names after philanthropic efforts, and they have those institutional names after those families. But outside of that, we actually have Epic, which is our electronic health system, through a partnership with Pacific Dental Services. And now people are going to ask me, well, Pacific and Heartland are competitors, and how are you working with both of them? And that's the answer. The answer is we want to be a space where we can partner non-exclusively with those that are looking to make a difference, so that our students and our faculty and our patients get the best of all worlds. Our educational component involves hospitals and healthcare systems. It involves federally qualified health centers. It involves our own academically owned and operated distributed model known as High Point University Health, which is a non-for-profit. And it also involves exposure to dental support organizations. So all of that is part of the student and learning journey in our model, which is very separate from us being a school that operates solely as a DSO or Heartland or anything
I love
else.
that. I think that is really cool how you guys are able to not be exclusive with anyone, and you're really just trying to give students all the options and the best education possible, which is the goal of every single dental school across the country, is to expose students to those things. So I love that. And I think it's really cool you guys are with Epic. I can't remember, what's the dental software that most schools use? I can't remember what it's called. I'm blanking. Oh yeah.
Axiom?
I had Axiom at my school. Man, that is a terrible software. I'm sure that's part of the reason why you guys decided to go with Epic. But is quite, I think students have no appreciation for that until they've had experience for both. But man, if students that go to High Point, you are blessed because you don't have to deal with Axiom as a dental software during your clinical years. So that's awesome. All right, another question that we typically see on these forums is, oh, High Point's not accredited, and that's not true entirely as well. So Dr. Cromartie, tell us a little bit about what schools have to go through the accreditation process and what is the status of High Point's accreditation?
Yeah, so I'll start with the status of High Point's accreditation. We did receive our initial accreditation August of last year, and that is why we have students, and that's why we were able to accept students to the program. Accreditation, I think commonly people believe that it's a one-time thing where you get your accreditation and you never see CODA again, and that's just how it stands. And it's in fact a process. And so when we had our visit, there were a lot of things that we realized we were ahead of the game with. And, we did pass our accreditation so far with flying colors. They do have to come back every couple of years to make sure and ensure that we are doing what we said that we were going to do when it comes to the safety of our learners, when it comes to the safety of our patients. And so that process isn't just a one-time thing. So I wanted to make that very clear. We're also very transparent when it comes to CODA accreditation. We provide that information on our website as far as the timeline, as far as where we are in the process and actually what's to come. That's also available on their website as well. And so with our initial accreditation, like again, we were able to accept students to the program, but it's not a one-time visit. They come back and they will visit every couple of years. And the next time they come back, they'll be interviewing our students and our faculty separately, of course. And so it's really in place to ensure the safety of our learners and also to ensure that we are doing exactly what we said that we were going to do. And so that's what I just wanted to say. Dr. Shazib, you may want to add something about the CODA accreditation.
No, I think your explanation was spot on, and it's a continuous process. It's called a quality improvement process, where it's a dynamic process. We have surveys we complete every year that provides the Commission of Dental Accreditation information about our program. It tells the Commission what our preparedness is, what are the areas you're working on, and it's a continuous improvement process. To receive initial accreditation means, and it guarantees, that the students that are admitted will graduate with a Doctor of Dental Medicine. And that puts us in a cycle that protects the students from being graduated, and that we, the institution, are meeting the standards that we've set for, that abide by or comply with quota set standards. That's important to know, because that means that, like our 60 amazing pioneering DMD students in our class, they're aware that they are enrolled because we met a lot of rigorous standards from the institutional resources, facilities, the educational program and curriculum, the clinical experience, the patient care services, and so forth, that we have shown and demonstrated and satisfied that these students, 60 students, will absolutely graduate and have a fulfilling career in dental medicine. And throughout this process, there are 3 steps. One will be before enrollment, which we've done successfully. The second visit will be in 2026 in April, in their mid journey, to see, are we doing what we're supposed to be doing? And then the third step is right before they graduate. And then after that, we are in what you call a complete accreditation, or final accreditation status, which means every 7 years, then we're on the accreditation cycle. But that still means every year we give surveys and provide information about our program. And it's always a give and take. It's always a continuous improvement cycle.
I think that's one thing that students don't realize is like, oh, they're not fully accredited yet. But like you said, Dr. Shazib, that when you pass that initial accreditation, those students will be doctors, and that is a wonderful promise that you're able to fulfill. Another thing that I think students don't often realize is every school undergoes accreditation every 7 years, and they have to pass every 7 years. So during my 4th year of dental school, CODA came, and I remember that they were scrambling and making sure everything was okay. And I just remember that process of it being very stressful for the administration to make sure everything was spot, and perfect. But all schools have to undergo accreditation, and I think that's something that students don't realize that they need to remember, which is an important aspect. Go for it,
Yes.
Dr. Cromartie. Sorry, I cut you off.
I was just going to add that was a great point, is that every school is undergoing, constant accreditation and feedback over the years. At any point, any dental school, even if they've been around for 100 or so years, can lose their accreditation. It's a rare occurrence that would happen, because there's several warnings that would go into place before a school will lose its accreditation completely. And so when a school is going through the accreditation process, we receive what's kind of like a report card, if you will. And if there's things that we need to adjust, then we have time to do that, and then to show and demonstrate that we have basically responded to some of the things that were in question. But we are in a good place with that. And so that, like I said, we're moving forward now with getting our Advanced Education General Dentistry, or AGD, program up, which is also going through the accreditation process. So this is with not just dental school, but this is with hygiene programs,
Residencies.
This is with residency programs. Yes.
It's with all of it. So, well, okay, I'm excited to get talking about your guys' program, because it's so unique. And you guys are really, like I had mentioned earlier, pushing the boundaries of what dental education is probably going to be in the future. So just as a broad overview, and we'll kind of pigeonhole down a couple different avenues here, what are some of the broad things that make High Point's education unique in your guys' eyes, as opposed to other educations that are out there currently?
I could talk probably for hours about this, so I'll add my 2 cents here. I think we have a unique focus of putting the patient at the center of what we do. And it's not just about the learners, but it's about our patients as well. The other thing that we are trying to do is there's an extreme focus in innovation and technology. And Dr. Shazib mentioned that there's digital dentistry, the digital dentistry fellowship, and oral medicine fellowship. But one thing that's really unique about our program that's not like your traditional dental school is that we are putting our practices in locations to meet the need where it is versus have all of the patients come to one building and you see those patients in that one building for the 4 years that you're in school or the 2 years that you get to be in clinic rather. We are immersing our learners in the practice environment as early as the first 6 weeks of their first year here. Now, not to do procedures that they don't have competency on just yet, but it's to get into the environment to learn what are the roles of the practice, knowing that we're all working together as a team. They're getting practice management kind of threaded throughout the curriculum. So that's something that we know a lot of dental schools do not touch on. The way that we are designing our curriculum, and we just had a workshop on a flipped classroom. We're making sure and we're intentful when it comes to the way in which we're teaching our learners, the way in which we're calibrating our faculty. And that looks very, very different from your traditional dental school. In the absence of tradition, we can be extremely innovative when it comes to building a dental school from the ground up. And so I don't know, Dr. Shazib, if you have anything to add to that.
So I'll give you an example. So for example, if this is a true example, so if our students are being taught tooth morphology, which is an often a very difficult subject because there's a lot of cusps and mesiolingual, mesiobuccal, and all the interrelationship between teeth, right? It's a critical component because occlusion is part of the core component of so much of restorative and rehabilitation dentistry. So the way we have our teaching or instructing tooth morphology is that our students learn how to scan a tooth and they scan partially, restored teeth and complete restored teeth. Then they actually prepare the tooth and then they actually do radiographic identification of teeth. So like how a dental assistant would have to learn how to mount in the correct order. So we're trying to embed active learning as efficiently, effectively, and at the higher cognitive level as possible. And if you look at Bloom's theory of hierarchy of taxonomy of critical thinking, we know that if you play with Play-Doh and you do different molds or you do different jigsaw puzzles, but you're applying it, then you tend to remember critical concepts longer than the repetition of knowledge. That's one example of tooth morphology, right? So you're scanning, you're doing restorative work in the simulation lab, which they're doing, and then they're also being exposed to radiology. So the anatomy is there, there's an application, and there's also digital weaved in. And then we sort of improvise where if there's a tooth that has an anomaly, what it looks like, that then is then brought in as they're learning the normal through that operating system. And then the prep work is usually foundational assessments that are built on activities as well. So they do prep work, there are videos. We have an app called Immersify. Immersify is an on-the-go pocket dictionary, but it's really augmented reality. So you can actually, on the phone app, have your tooth charting, and you can do your tooth charting in space and have students have an immersed environment. So even if they're not in the classroom, they're doing something more applied with the knowledge that can sometimes be very dense and difficult to learn. So that's just one example of the educational journey that our students right now in their 14th or 13th week are doing, which is a little different, where it's usually incremental and the technology is incremental. We brought the technology up front and the knowledge applied, and always in the reference point of a clinical case, a patient scenario. So a patient XYZ presents with this. How would you approach it? What would you do? What's the biomedical consideration? What's the behavioral aspect? And then the clinical, encounter and everything that we would do in real life, we try to bring into the very elementary aspects of our curriculum. So I do think that example is important for learners because every learner has a different style of learning, and we try to adapt it that way. And the second part is remediation. The word remediation is usually taken as, oh my God, like I'm not doing well. What do I need to do? We have deliberately built in every 6 weeks, 1 week of remediation. So that allows a catch-up period for learners for personalized learning. There may be a concept they want more reinforcement in, or a practical application they need more reinforcement in, or before they're practice ready, we don't think they're meeting the benchmarks of time, efficiency, or what we think the real world needs. We have built in those remediation periods so that the people who want personalized education receive it, and the ones who are, let's say, excelling can push themselves more and spend that week doing enriched experience, maybe spending more time in the practices or doing research projects or other things that they may have
That's great.
interest in.
I think that's a thing that you don't see in any dental school, that remediation period to help you focus on what you are weak on and take that as and run with it, which is really cool. I love that. So that's kind of that personalized learning that you're talking about. Is that kind of what we were discussing earlier? If I understand that correctly? That is.
Yeah, this is the personalized learning, and if I take the curriculum from first year to
Mhm.
fourth year, the graph becomes very, very heavily exponential, which means in the very first year, they're half a day a week in practice learning the
Mhm.
support care roles. If you think about, like, for example, Waffle House, a very successful franchise, to be a manager at Waffle House, you need to know what every single person and employee does in the company so that you can be as successful in growing your people and being a leader and being a manager. So our D1 learners are right now understanding what a front desk coordinator does, what an insurance coordinator does, what an assistant does, hygienist does, what a morning huddle is. How do you look at a practice dashboard and compare it to another location, right? While they're doing this in their second, third, fourth year, they become more and more immersed in practice and they become more care providers. By the time they're in the third year, they're 100% of the time in the practice, and they come back every 6 weeks for 1 week of that remediation slash assessment period. And then they have 2 full years of clinical experience. And there's a personalized phase, which is that in the fourth year, they spend 3 to 4 months choosing an externship of their interest. It could be doing a podcast, it could be material science, it could be AI, or it could be clinical specialty of interest. That's their sort of in their fourth year, it's their identity sort of solution. What do I really want to do when I get out of school? And that allows us to
Wow, that's
support them for that.
incredible. So with that kind of model, it sounds like students are only in the practice about 1 day a week currently, and they're 13, 14 weeks in, which is crazy that they're in kind of getting that experience right now. But as they progress through the curriculum, how many students are at each site? Because you had mentioned, Dr. Cromartie, that there are multiple different sites that you guys are working at. How many different students are at each site? And then, like, what does their timeline look like as they go into that second and third year? You'd kind of mentioned that a little bit, Dr. Shazib, that third year you're full-time in the clinic already, but how do you guys rank them up to that level? So Dr. Cromartie, go for it.
So yeah, I first want to describe what this
Yeah.
network looks like. So the oral health network is it's basically an area of community practices, which we have, correct me if I'm wrong, because we've been growing fast. It's 8 that are open and operational right now and fully staffed. And so then in addition to that, you have 3 large hubs. So if you're not from North Carolina, High Point is where actually the building we're in right now will be the High Point hub once we move into our new building, Workman Hall on main campus. We're about a mile and a half away from main campus right now, in the former Chamber of Commerce building on Main Street in High Point. So currently here is where we have our haptics lab set up, our simulation lab, our iSims, we have administrative offices and a classroom. And so the learners are here right now until we move into our new building. So with the Oral Health Network, you have your community practices, the hubs, which are like 30 plus chair surgical and specialty and general dentistry suites. And then we'll have 3 of those. So Winston-Salem and Greensboro are both about a 20-mile radius in either direction from High Point. And so you have your 3 hubs, you have your practices, which with the 8 that are open and operational, we're looking to have close to 30 by the time that we're done growing. And so in addition to that, we have our oral medicine specialists that are located at 2 local hospitals, Atrium, Wake Forest Baptist, and Novant. And so in addition, we have our fairly qualified health centers. And so the objective is to give our learners and our residents a very diversified clinical experience. So right now we have the first class of students. They're spending about a half a day in practice right now, and that will increase by another half a day as the semesters grow. And so right now there are three to four that are going to the practices. Maybe they have a morning rotation, and then in the afternoon they're split in, since it's 60 learners, they're split in groups of 20. So there may be 20 at any time in the classroom. There may be another 20 in the simulation lab, and then another 20 that are on a clinical rotation for that period of time during the day. So on Mondays and Fridays, all 60 learners of the cohort are together, and a lot of times they're having lecture in the classroom, and so it takes a lot of planning in advance to know where everyone's going to be. But we did give them a preference of telling us, where do you have a preference of where you'd like to start your experience in the clinics, and so some of them didn't have a preference, some of them did. If they are from an area that's closer to a practice, where like if they are from out east where they have Chapel Hill, we have practices in Chapel Hill and Durham. Some of them are familiar with the area, some of them are from that area and they want to be in that practice. We have some learners that are from Randolph County, which our Randolph practice, they are going to shadow there. And then we have some that are right here from the Triad area. And so, they're able to rotate through these practices, but eventually they'll be rotating through the hubs, they'll be rotating through the hospital, and they'll have research opportunities kind of embedded throughout too. So very exciting. This model does not exist in adult education. So we are the first to do it. And we're just really excited about that opportunity too.
I love that. So for those practices, are those students assigned that practice for all 4 years? So like those students that want to be in Durham, that is their home base pretty much for 4 years. They'll come to the different hubs and rotate and things like that, but that's their main base.
Yeah, I think the objective is to give them a couple of different practices to rotate through. So they're not going to be ideally at the same practice the entire, couple of years that they are going to be getting that experiential experience. And correct me if I'm wrong, Dr. Shazib, maybe something's changed since I've been gone. But I think that the objective is to give them experiences in different settings so that they can appreciate what that looks like working with different providers, and being in different areas of the state to really see what the need is and what it looks like and how they can be a part of supporting those patients through their clinical journey.
Dr. Shazib, anything to add with that in particular?
The really exciting part of this model, which is a first of its kind in dental education, it's not a first of its kind in healthcare. So if you think about Duke School of Medicine, right? You have Duke Health, which is the clinical enterprise, which is providing care at the doorsteps of the patients, where they meet the patient at their doorstep, number one. They're also a preeminent destination for complex care, for clinical trials, and for education. Those three things are sort of just there very organically and harmoniously. In dental education, we don't weave the three as deliberately as we do in academic medicine. If your loved one has a complex cancer or need, you would go to likely an academic health center, to a cancer center. You will have access to proactive clinical trials that will likely save lives. What we're trying to do is create a similar network where we're spreading the community, providing care on Epic. And the beauty of it in the educational model, what we propose, or our hypothesis is, rather than in student clinic where you have maybe one faculty per 10 students and they're waiting for a check, in this intimate environment, your ratio will never be more than 3 students on 3 chairs to one faculty.
That is awesome.
Because the environments are intimate. So think about that. So think about if you were a D3 and you're assigned in Dr. Walter's practice in Chapel Hill, and there are 3 operatories. They've been assigned patients. Dr. Walter is attending to just those 3 learners and assigning cases, discussing morning huddles, going through the procedures, and doing it within a schedule that looks like a real life schedule, not a 3-hour block, but let's say half of that time, so that there's the awareness of, in the real world, if I need to be successful, I need to understand time management. I need to understand prioritization. I need to know my limitations as a provider. And then you have those mentorship debriefs and moments. And all of that is logged into portfolios through Epic. So that's just an example of the operationality of that. And the goal is a balance between, like Dr. Cromartie mentioned, going into the practices, getting various exposures, but continuity of care. So you actually see your recall patients and you actually finish treatment plans, which usually is very hard to do in dental education. We usually have a number of patients assigned, and then you have to really hope and pray that they show up. And if they don't show up, then your day almost is wasted. So that's not the model.
Wow, that's incredible. I think that is one of the strengths that you guys have definitely exhibited so far, that having that small student to doctor ratio, having it be more like a private practice setting. Because I remember I went to VCU, and you have external rotations, you're like fourth year and you get to go for 3 or 4 days and you get to experience, wow, this is what private practice is like. That's like your guys' whole education, which is incredible because I didn't learn time management until I was in my fourth year, and it was just a couple weeks sprinkled in.
Dr. Townsend,
Yeah.
let me ask you a question. Did you do hygiene checks when you were on your
Uh,
rotations?
I did some hygiene, but I didn't do hygiene checks. So is that something that you
Yes,
guys get to incorporate then? That's a huge thing.
absolutely. So think about it. When you get to practice, you're worried about the dentistry, but there's so much
Mm-hmm.
more that goes into managing an office. You're trying to manage your staff, you're trying to manage your patients, you're responsible for checking hygiene, and that's a part of your practice. And so when you speak about time management, that's something that early on, if you know about that in dental school and you know it's coming, you know that time management wise, you have to manage your time for, okay, I need to go ahead and get this patient numb. Now I need to go
Mm-hmm.
check hygiene. Now I've got an emergency patient that came in. How would I work them in on the schedule? And so we want to practice that with our learners, have them see us in practice do it, have them see how we handle challenges so that they realize
Mm-hmm.
we're all human. And this is the practice of dentistry for a
Yeah.
reason.
No, I love that. That is a very, very cool model. So another thing that I'd love to touch on that Dr. Shazib, you mentioned earlier is you guys are printing, which 3D printing, which that is a new field. We do a lot of 3D printing in my office. Um, and you're incorporating AI and just the digital side of dentistry. Talk to us about your guys' goals of what you hope to accomplish by introducing students to the digital side and the AI side and how that will help them in future practice as well.
Thank you. And I think we are at an information revolution, right? Where we will be able to retrieve information much better than most educators will be just by virtue of where we are, right? We can find and retrieve information so well. The question is now with technology, how can we be more efficient and how can we deliver care that is more standardized and also, we can do it
Mm-hmm.
in house and have manufacturing capabilities for same day dentistry. So languages like STL, PLY, DICOM,
OPJ,
JPEG
yeah.
have to be enabling class. People need to understand these terms. Like, yeah, maybe 20 years ago we didn't need to understand that stuff. Now we have to inherently understand those languages and the connections and the limitations of all. So as part of our patient journey, because everything we do in the real world influences how we teach. That's rule number one, and that's a very important rule. Is what we do in the real world has to be transferable, translatable, and measurable in the education setting. So, as part of all our new patients, our model is that every new patient has a digital
Wow.
standardization, which means as part of being a new patient, they will be scanned, like a 3D intraoral scan. There will be a baseline cone beam CT if they've never had radiation exposure, and depending on the radiographic needs. And then there will also be intraoral photographs. So now you have a digital footprint of your patient. We also have salivary testing in our practices that do point of care saliva testing for markers of inflammation such as matrix metalloproteinase 8. That is a measurable biomarker for periodontal inflammation. It's not the all and done marker, but it provides an educational tool for patients to learn about their overall inflammation status. You can discuss perio from a biomolecular standpoint, from an inflammation standpoint. That is the journey of our patients in our network. So that is the journey that our students learn in their curriculum, so that there's no disconnect between what we're teaching them and what's being done in the real world. So digital is, in my opinion, a very nice way of standardizing the
Mm-hmm.
patient's information, so that if there was an emergency, you can design and scan and deliver something. And we'll also have an in-house lab where we will be able to uh, email or send scans and be able to do in-house manufacturing where students will be manufacturing surgical guides, study models, temporary provisional restorations, implant guides, all of that stuff. And what will also happen is that this will allow us the capability of importing a patient scan into the simulator system so that the student can do, or resident can do, or faculty can do a mock-up of that procedure before we do
Mm-hmm.
it in the clinic. So let's say you had a patient scheduled for quadrant dentistry, 13 MO, 14 MOD, and 15 MO. And you're not really sure if the third year dental student is ready or not, or your AGD resident's not ready, or your new faculty is not calibrated. we can import the scan, the DICOM, it can convert into a PLY, and we can voxelize and actually recreate that model. And we can measure time, efficiency, and how ready they are. And they can print that and then they can restore it. So they have a whole way of calibration that, it's like a pilot. They learn how to fly on a simulator. They know how to do bird hit landing, engine failure, all the scenarios they do on the simulator. They don't do it on the patient. So that's our challenge in dental education. How do we do the complex, complicated, not harming patients, but doing it in a way that we can do it in a safer environment so that we can then be
Wow,
ready for
that is
patient care.
truly revolutionary. Dr. Cromartie, were you going to say something else there?
I was just gonna, and I think that was awesome the way that he told that story. One of the things I was gonna add is, as a learner, getting that type of exposure is incredible, because when you're graduating, whether it's going to residency, whether it's going to private practice, whether it's working for one of the companies that you get a little bit of engagement with as a student here at the Workman School of Dental Medicine, I just feel that it is awesome to get that type of exposure, because it just makes you that more marketable when you graduate and you go to your next steps. Because say you go to a practice that doesn't have that type of technology, you maybe could be the one to convince them, because you could train the office staff and any other providers of how to utilize it. So you essentially become an asset of going through this program as a learner or a resident, or even a faculty member, because we're all learning alongside of the students as well. But I just think the exposure is awesome, because it just makes you that much more marketable. You have that many more tools in your toolkit. And so, just getting that at the level of dental school is just incredible. They're already learning how to scan. We have Prep Check. They're using that now in the simulation lab. That gives you more of an objective view of how deep do I need to prep, or how wide, or it's telling everything from an objective point of view, which is a very useful tool when it comes to calibration.
And if I just may add, Dr. Cromartie-Hicks really nailed this point, which I think I just want to tease out a bit more. The ability to train someone to self-assess is critical. And that's a prep example, right? So that you could be 7 p.m., scan your prep and know where you stand, and look at the function of time and know where you stand for the real world. So I think that was a really critical concept you brought up.
So in school, like, how historically, and you guys probably experienced this through your dental education, you make the putty and you make sure you have your reduction and like everything's smooth and you spend time polishing it. And then now, like, the office that I went to has a CEREC machine, and like we're designing our own crowns in the same day. And then like I go through the first couple times, like I prepped, I was like, holy heavens, that prep looks terrible. Like, or like, you're like, I don't have enough reduction here. Like, and you can just see so much more. And like you said, Dr. Shazib, your self-critiquing ability, that scanner is an excellent tool to self-critique. Because if you're like, I can't design a crown on this isn't going to work. You're going to have to figure out how to make it work, and your preps dramatically improve, which I love. So real quick, I don't want to hold you guys too long. I have some more questions. Are you okay if we kind of go a little bit over the hour here? Okay, perfect. Well, as we kind of transition into how are you guys helping pre-dental students? You guys have a very unique application. And I kind of want to touch base on that and why it's different. And then what you guys are looking for in applicants, and who are the prototypical students that are going to fit into High Point's dental school the best. So Dr. Cromartie, tell us a little bit about how the application is different than a typical AdSAS application, and then why it's that way.
Yes. So thank you for allowing us to talk about this. This is extremely important. So we are not participating in the ADIA Assets portal at this time. You would apply to the Workman School of Dental Medicine with a link that is accessed directly on our website. When you open that link, it takes you to what's called the Slate portal, and that is your application. The application is free of charge. We did not want to contribute to what we know is the financial burden when it comes to applying to dental school. We know that it's extremely expensive. All three of us have went through it. And so our application is free to apply to. The only thing that you're paying for, which does not go to us, it goes to a third party, is Acuity Insights, and that's the Casper and Duet portion that it's required for a complete application. The reason why we are going this route is because, one, we've realized that the questions and the things that we want to know about our applicants, we can design ourselves through this portal. We've went through a variety of committee meetings to decide what it is that we're trying to do and trying to obtain as far as information from our applicants. And the application even became more concise from last cycle. So we are actively reviewing what's working, what's not, and the information that we want to obtain from applicants. So on the application, a lot of the things that we're looking at are experiences. We're looking at depth and we're looking at breadth in a variety of experiences. So, I mean, organizational membership. What have you done to prepare you for the rigor of dental school? Have you had any leadership roles? Is there any research that you've taken part of? From an entrepreneurial aspect, have you started any organizations? Have you started a business? Now we know that influencing is extremely popular, and we want to hear about stuff like that. What are your passions outside of dental school? Because it's not all about the dentistry. You have to have life outside of that, right? And we are looking for well-rounded applicants. We're looking for academic growth over time. Not everyone has a 4.0, and that's okay. So what have you done to improve? If you had to retake courses, what were your grades like before and after? If you've done a post-bac program, what does that look like, whether it's certificate or not? If you've done a master's program, what is the academic growth? What is your story line? What is your academic storyline? We're looking at that to see if you're a good fit for our program and are you ready for the rigor of dental school? It's going to be hard no matter where you go, but can you handle the way that we've designed our curriculum? Will you be successful here? Is really what we're trying to determine. And so those are some of the things that we're looking at. Shadowing. If you've shadowed a general dentist, that's great. And we don't have a requirement for shadowing hours, but we'd like to see that you've taken the initiative to shadow a general dentist, maybe an endodontist who specializes in root canals, maybe an oral surgeon, maybe a pediatric dentist who's seeing kids all day, or an orthodontist. We want to see that you've taken the initiative to expose yourself of the different disciplines of dentistry, to get an idea of what different types of dentists will do. And so those are things that we're looking for. When it comes to the interview process, it's very unique because we will interview anywhere from 25 to 50 students at a time. And so it's a combination of one-on-one interviews, group exercises in a classroom setting, haptics, which we have the largest haptics lab in the world. You're not necessarily graded on haptics, and we're transparent about that, but we're looking to see how you respond to an assignment when it's attempted more than once. Do you quit when you hit a wall, or do you pivot and go around it? We're looking for evidence of a growth mindset. And so the questions that we have in our one-on-one interviews, we provide to all of the applicants ahead of time, so that it's on you to review that information. And if you haven't, it's very obvious if you're not prepared. There's lots of opportunities to do pre-learning or prep work, as we call it here. And so that's just an example of that. And so when you're in the group exercises, the objective is to see what it would be like to be in a classroom setting with us. How do we run our flipped classroom? How do we run walking through a patient case scenario? And so what we've heard, and we also include a tour as part of the opportunity to interview. But we also ask for feedback. What is it that candidates like? What did they struggle with? How can we improve for the next cycle? And we're not built with so many constraints because we're not using the IDEA Access Portal, because we're designing our interview process the way that we want to. And so it's worked really well. Last year we had over 1,400 applications. We interviewed over 500 of those applicants, and it was only for 60 spots. And I wish we could triple the size of the class. But with accreditation, it's just not possible at this time. But there are so many applicants who are well qualified and ready to go to dental school, but unfortunately only 60 that we can admit. This year, it looks like we're on track to do the exact same thing. So far, as of yesterday morning, we had 1,040 applications, and our application it hasn't closed yet. It will close early December. And last year it closed the end of January. So we're already kind of ahead of where we would have been last cycle. And we're not interviewing as many people now that we have resources spread, and now we have an inaugural cohort here, and faculty have other responsibilities going on, but record-breaking year for us. And so that's kind of how we've designed our application, why it's important for us to do it that way, how we've designed and are redesigning our interview process, and reflecting as a brand new
I love
school.
that. Now, I'm going to ask you a loaded question here because this is something else that I've seen on Student Doctor Network and Reddit and heard from students. Is they're like, man, they don't require the DAT and they don't have required classes. Like, how are they even judging me at all? I'd like to hear your guys' opinion on why you did that and how that was a strategic thing and how it's worked in your guys' favor, especially with your inaugural class.
I'll let Dr. Shazib, if you'd like to comment on this before I do.
Well, I know you had some colleagues are really nice, good friends from Pacific Northwest as well, who may have talked about that. Them also being an institution that is agnostic to the DAT, which is not required. I think it's a for us. We look at it this way: we want to have uh, the ability for our applicants to express themselves as broadly and holistically as possible, to show if they demonstrate the necessary skill sets, emotional intelligence, and scholarship necessary to be a healthcare provider or to be a healthcare leader. That's what we're looking to measure. And there is a big discordance of data of whether the dental admissions test correlates to that exact outcome, which is employability, which is how well you will deliver care and how you'll provide empathy and how you'll manage people and practices. That data is not directly
Mm-hmm.
proportional towards success. What it does show success is the biomedical sciences, and it does show some level of correlation to understanding and synthesizing concepts that are in sort of the science sector. But we wanted to remove all barriers, financial, as well as, let's say you are an outstanding dental hygienist who has practiced for 8 to 10 years and really want to get to that next level where you want to pursue a career in dental medicine. But because you didn't take one or two things, but you've done everything else right, why shouldn't you have the opportunity to apply? Why shouldn't you have the ability to express and demonstrate your aptitude and skills at that level? We're not trying to lower the bar at all. Our acceptance rate is less than 5% in our program. What we're trying to do is allow people to show the combination of emotional intelligence, scholarship in their perspective of scholarship, and tailor it to our curriculum and how we will prepare them to demonstrate their overall career objectives. So we are still very committed on remaining DAT agnostic this admission cycle. And obviously, we'll need to discuss the next year's admission cycle. But that just means we have to be very careful and intentional on how we convert the high school, the college, undergrad experiences, and making sure that they'll be able to meet the
I
rigor
love
of the
that. I think that
curriculum.
was beautifully put. Dr. Cromartie, did you have anything you'd like to add to that?
No, I think that, there are a lot of other programs from what I've heard that are reviewing how we've kind of set up our system to be the DAT agnostic. And so when I think about my experience, I know that so many were discouraged from applying to dental school because of this scary DAT exam. And, that's one of the things that can become a barrier for certain populations of people. And like Dr. Shazit mentioned, we are trying to remove those barriers, financial being another one. Depending on how many schools that you're applying to, your application itself for a DAS could be thousands of dollars. Then you have supplemental applications to worry about. The DAT is close to $500 now, if not more, the last time that I checked. And so for those who have the resources to take a DAT prep course or an iPrep course that could be several $1,000s, they're privy to the exact same questions that are on the DAT. And so then it becomes, those that do not have access to those same resources, they're more disadvantaged when it comes to preparing for that and maybe doing really, really well. We've seen learners that do really, really well in the DAT, they get to dental school, and it's just as challenging as it is for someone who maybe didn't do so well. So, or did really well in the DAT. So, when it comes to the biomedical side of the didactic courses that they're taking, the first 1 to 2 years of their dental school experience, yes, I can see definitely where it could be strongly applicable in needing that type of exam to look and see, where's the bar. But there's so many other things that we're measuring, and hence why we have Acuity Insights. We're trying to see about emotional intelligence and are you a good fit for our program. We are looking at your GPA. We're looking at your academic story, if you will. We're looking at a lot of other things that other programs may have just crossed you out and not looked at your application at all because you simply don't meet these standpoints. The flexibility allows us to take a second look at an applicant who may do really, really well in our particular dental school. It doesn't mean that they'd be successful elsewhere, but for our program and what we've designed, we have found really good fits, and our learners are from all over the country. So that's just something to keep in mind. But that was I'm so glad that we get the opportunity to debunk some of these myths because we do read the blogs. We are aware of what's out there and giving us the opportunity to just tell you the truth and what it is. And our purpose of doing things this way allows us to just set the bar straight.
So as students kind of look into their different options for going to school and they are deciding what school to go to, who is the ideal student from your guys' perspective that you want in your school, and who is the ideal, how do students know that they are perfect for High Point? Dr. Shazib, what would you say to that?
I think there's an inherent level of entrepreneurship that we are looking at in terms of the applicant pool. And one thing is we don't want our 60 learners to have exact photocopy attributes of each other. We want a diversity of perspective, a diversity of mindset, and diversity of interests that will hopefully cross-pollinate thought leaders in our healthcare system and industry and regulation and the whole care domains, clinician, advocate, research, and entrepreneur. So we think of it that way. When we think of the whole applicant that we are interested in, is we think somebody who is a servant for advocacy and public health, somebody who has demonstrated a novel approach to something that has simplified or benefited humanity in whatever aspect they could, somebody who has provided care for others, somebody who understands empathy and has been in areas where they've done that. To me, those values are really important because we are a values-based school. We have a very strong recruitment process that goes along our core values: compassion, collaboration, integrity, innovation, and growth mindset, right? And it's really important that in our interview questions, which we disclose, we actually give our 50 interview questions that will likely be asked. It goes to those core values. That's also for faculty recruitment. It's a values-based system. So we look at those values in the application pool. So we want someone who is demonstrative of those values, somebody who's looking to take some risk. That's the entrepreneurial aspect, because we are a new program and we are a fairly different model. And we want to be absolutely transparent about that this is going to be an environment where failure is going to be a learning opportunity. Failure is going to be something we want to teach people to embrace, not to expect, but failure is one of the recipes for ultimate success. And we want our applicants to demonstrate how they respond to failure and how they are withstanding of the feedback of that. So to me, that's the sort of qualitative aspect. And then the quantitative aspect is obviously making sure they've taken courses or studies or employments in areas that have been challenging, and they've had discipline and they've got good work ethic and good behavior.
That's wonderful.
That's wonderful.
I would love to add to that because I get this question of what type of student are you looking for almost daily. And I always encourage them to not ask an admissions director, what type of student are you looking for? I want you to be the type of student that we cannot ignore. Be the type of student that we say, we need this person in our class. This would be an asset. This person would be an asset to our cohort. And here's why, X, Y, and Z. So of course, we're looking for someone who has an ethical standard, who embodies our care roles. If they've done their research and they've looked at our website and they know about our care curriculum and the care roles, then they don't have to ask me about those. So I would say we always encourage those candidates to be their authentic selves. I think it's extremely important when you're going for your interview to not be who you think we want you to be. Because if you get here and we're not a good match for you, those are 4 miserable years that you are going to have. And that I speak for any dental school that you're applying to. Do your research and make sure that school is a good fit. Talk to the existing students and see if you can see yourself being here for 4 years, it is a commitment of your time, your money. It's going to be stressful at times, but you want to make sure that what you're looking for, what you need out of a dental school program, that you're going to get while you're here. We're looking for learners that are creative. And like Dr. Shazib mentioned, risk takers. I'd call them pioneers, because at a new dental school with no tradition, you're going to be a part of building that culture and that tradition and that legacy. You're going to have an opportunity to start organizations and be founding members of those organizations, where 20 years from now, you look at the growth because you were a part of that on the ground floor. We're looking for, you know, students that are unafraid, because you have to be when you're the first to do anything. Servant leadership is something that I'm specifically looking for on applications, and evidence of that, not just within the year that you are applying, but what have you done in the last couple of years? What does that community engagement look like? If you've been on an organization, it doesn't have to be all dentistry that you're doing community service in. What other aspirations and what other passions do you have outside of just wanting to be a dentist? Because I strongly believe that dentistry is what you do, but it's not who you are. So it's about what you can bring to the field. And also, um, yeah, what can you bring to the field? What makes you the type of learner that we cannot ignore? And so that's what I encourage people to do. And that's my response when I get asked that question. They want me to give them, well, we want you to have this GPA, and we want you to, there's not one student that looks exactly like the other in that inaugural cohort that's right outside these doors. They all look and do different things. They all have different skills and different gifts. And that's what makes our program special.
That's wonderful.
If I may just add one item about our admissions model. So it is blinded in the sense that the application selection process, and I'm being very transparent here, is that the application reviewers are usually blinded to the interviewers. The interviewers don't have the complete application, so they're blinded to that. And then the interview selection committee is blinded to the interviewer and to the applicant, and they have a anonymized ranked order of all the activities that were performed that included haptic simulation, classroom experience, values-based structured questions, and then a rank is created based on that. And then that goes back to somebody who's not in that committee, who then anonymizes it. So then there's a list. That is how the initial application selection occurs on a rolling basis, so that it is, we're filling our cohort as we go. The ones who don't make it, right, also are offered. Dr. Cromartie has done this, and I have to commend her for this. She herself will call applicants who did not make it, or who got a reject or a status response, a personal feedback session. She will speak with each interviewee or each applicant and talk to them and offer them the opportunity to prepare themselves for a career in dental medicine. We believe that's our role, is to help these applicants get somewhere. I have personally helped mentor successfully candidates who didn't make it into our DMT program into externships, into other sites, so that they can build their credentials. So we try to offer as much mentorship as we can, so that these applicants can go and succeed in the goals, because it's a difficult world where getting time and getting feedback can be very difficult. And I have to commend Dr. Cromartie.
That is super cool, Dr. Cromartie. That's a thing that not all dental schools do, and that to have that one-on-one touch and mentorship that way from the school is nearly unheard of. So that is wonderful. As we kind of come to a close here on our podcast today, do you guys have any final things that you want to highlight about High Point before we let you go for the day?
Oh my goodness. If you have not applied, what are you waiting for?
I like it.
That's my PSA is if you have not applied to our program and you feel like we are a good fit, don't delay. Our application will close early December. Because we are not participating in a DIA access, we do have the ability, as being enrolling admissions, to offer admission to the program prior to the traditional time of hearing in December. So our application cycle is coming to a close, but if you are applying next cycle, that will open up next summer. Just please pay attention to our website. That's where we have the most up-to-date information. And if you're contacting our team, our DMD admissions at highpoint.edu email address is the quickest way to get feedback, because some of our faculty are still practicing. Dr. Shazib still sees patients as an oral medicine specialist. I'm a general dentist and I'm still working in our practices. And so we have several people checking that account throughout the day to give you the most quick responses we can. So we are a dental school that will respond to you. So I would just encourage you to please contact us on that route.
Awesome. Well, Dr. Shazib, anything?
Thank you.
Oh, sorry, I cut you off.
I want to thank you for the opportunity, for the insightful questions, and your podcast has such amazing content that I do think that's a plethora of resource for people that are looking to understand about the intricacies of each program. As an educator and as somebody who's also an actively practicing provider, all schools, unequivocally are doing their very best to train the best dental graduate out there to provide excellent care for their patients and to be innovators and leaders in healthcare. And we're equally passionate. We're very excited about the career where it is, with the rapid technology advances, with the complex needs of our growing population. There's just tremendous opportunity to serve. And my only sort of message to anybody on this podcast that is looking or interested in a career in dental medicine is keep knocking on doors, keep asking questions, be curious, and you will find a program that will be a perfect match, and you will find a fulfillment in the career in dental medicine. And we are one of those destinations, and we're very proud of what we're doing. But we're also equally excited to be holistically in a field that is really going to impact healthcare as a whole. So thank you for allowing us the opportunity to be here.
Thank you guys. Thank you once again, Dr. Cromartie and Dr. Shazib, for coming on. We've really enjoyed it. And I think students are going to find a wealth of knowledge out of this episode in particular. So that is it for today's episode of the Dental School Guide podcast. And thank you for joining us.
Bye.
That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.